hear him say that he's a music channel. I hear him say that he's a music channel. I hear him say that he's a music channel. I hear him say that he's a music channel. hear him saying that he's gonna move their chair. I hear him saying that he's gonna move their chair. I hear him saying that he's gonna move their chair. I hear him saying that he's gonna move their chair. I hear him saying that he's gonna move their chair.
Hello, and welcome to People's Community Clinic. This year, we're bringing you our No Such Thing as a Free Lunch event from the clinic here in North Austin. I'm Bill Hopkins, and this is Karen Burgess. We are both trustees for the Foundation Board of People's Community Clinic, and we are honored to have the opportunity to serve as your host today for this event as we reflect upon another extraordinary year at People's.
To say it's been an extraordinary year is quite the understatement. While the pandemic has been challenging to all of us, for many of our most vulnerable neighbors, COVID has intensified struggles that they already face. Because of you, because of your generous support, People's has not only been a lifeline, but also a beacon of hope to thousands of individuals and families during the greatest healthcare threat in generations. And because of you, People's endures as an essential part of our community's healthcare safety net, ever present during a most challenging time. We are grateful to each of you for making that possible, and to the clinic staff who, despite significant obstacles and difficulty that COVID brought on, continue to deliver high-quality healthcare with skill, respect, and courage. It is my honor to introduce to you the distinguished leader of People's, CEO Regina Rogoff. For almost 2 decades, Regina has led the clinic with dignity and vision, forging partnerships, expanding programs, overseeing the construction of a cutting-edge facility, and overseeing a thriving era for People's Community Clinic. Regina.
Thank you, Karen. I'm speaking to you from People's Center for Women's Health, where we focus exclusively on women's health issues. Texas ranks at the bottom of states in women's health, but we are trying to change that here in the Austin area by increasing access to critical family and female health services like prenatal and postnatal care, women's wellness exams, including breast and cervical cancer screenings, and family planning services. Thousands of women, their children, and their families are fortunate that your generosity makes a better and healthier life possible for them. With your continued support, People's Center for Women's Health will continue to be a pace setter in expanding wellness for Central Texas women. This annual event happens because of the hard work and generosity of our Foundation Board of Trustees. Thank you to our hosts, Bill and Karen, and thank you to the other board members of that body: Becky Beaver, Marina Cifuentes, Nona Nyland, Nancy McDonald, Sujata Ajmira, Lindsay Leverton, and Marshall Thompson. And most of all, thank you so much for joining us today. Your caring support continues to allow us to serve patients who without People's would not have access to quality health care. We are so glad you are here.
Thanks, Regina.
You know, Karen, it's true. Many people contribute to the great work done here at the clinic. People's Community Clinic also wouldn't exist without the dedication and expertise of its board of directors, led by Fred Blackman and People's staff, beginning with Chief Medical Officer Dr. Louis Appel. We also owe a deep debt of gratitude to the St. David's Foundation for providing sustaining support since 1996. And we thank the Michael and Susan Dell Foundation, Episcopal Health Foundation, Methodist Healthcare Ministries, and the St. David's Medical Center for partnering with us to bring innovative programs to our patients. And of course, this wonderful event doesn't happen without our sponsors. I want to recognize Rudd & Wisdom, Ricky Rushing and Alan Gilmer, Sarah Buss, Dr. Isabel and Dr. Russ Hoverman, Tito's Homemade Vodka, Marina Cifuentes, and the Jastro Foundation. Thank you all for what you do and what you've done.
You are in store for a fascinating program today. We're going to do something we can only do with a virtual event. That is show you the inner workings of the clinic, featuring staff who lead these programs on a daily basis during the normal times and the not so normal times. So today, as COVID often requires, we're going to take a detour from the normal and provide you an inside look at how People's staff rose to the occasion to carry on their normal functions while quickly and comprehensively adapting to the not so normal times of the COVID pandemic. We'll also step outside the clinic to recognize those who went above and beyond to keep our community healthy and safe. Usually we honor one person with our W. Neal Kasurik Award for Health Advocacy. But this year we're honoring 3 groups for their outstanding service to the community during these unique and challenging days. We cannot wait to hear their inspiring stories. Then later in the program, longtime friend of the clinic, Evan Smith of the Texas Tribune, will visit with our special guest, Dr. Peter Hotez, an internationally recognized physician scientist who leads a team developing vaccines for the diseases that affect millions of children and adults. So thank you again for joining us and for your support of People's incredibly important mission. Sit back and enjoy this year's No Such Thing as a Free Lunch.
You know, Karen, this is a perfect year to recognize the staff at People's Community Clinic, because these compassionate professionals have been on the front lines every day during this pandemic. In the early days, they even risked their own lives and health to make sure that the community's most vulnerable people maintain their access to health care. I am personally inspired by their dedication. People's Chief Clinical Services Officer, Monica Cavazos, and her team were charged with developing and implementing new processes and procedures to protect the safety of the staff and the patients. And to make it crazier, they had to do it practically overnight. We're so grateful to Monica and her team, and for Monica to join us today to tell us more.
Hello, I'm Monica Cavazos, registered nurse and Chief Clinical Services Officer for People's. Many of you are familiar with how the clinic works during normal times. Today, I'm going to share with you how the clinic has responded to the pandemic and how we've made changes in our service lines to continue delivering care while keeping our patients and staff safe. The past year and a half have been incredibly challenging for People's and our patients, as I know these times have been difficult for all of us. People's began drafting preparations for COVID in January of 2020. But when COVID actually hit in March, there really was no playbook for exactly what to do. The clinic had to quickly change our ways of seeing and serving patients in a short period of time to reduce risks. We were also short on protective gear and had to rely on our relationships with donors and the community, who donated thousands of masks to us. One of our physicians even made face shields for clinical staff during the worst of the pandemic. Even during the worst of times, our goal to serve our patients remained unwavering. The clinic, from its founding, has been dedicated to treating patients with dignity and respect. It's part of our DNA, and we've stayed true to that. Our response to the pandemic was to ensure that those who are most likely to fall through the cracks don't, and that is written into our mission statement, to improve the health of the medically underserved and uninsured. The clinic has remained in full operation during the entire pandemic. Many of our usual workflows had to be changed, and we added a safe way to treat patients with COVID symptoms, to do COVID testing, and to provide COVID vaccinations. There are key goals that served as a foundation to our response to this pandemic: to be safe, to be efficient, and to make it easy for our patients to access care. We started early on with drive-through testing for COVID to reduce risks for patients and staff, and later added strep and flu testing. At our Center for Women's Health, we instituted drive-through birth control injections. And this fall, like last fall, we're providing drive-through flu vaccines. A very generous friend donated the big tents outside the clinic. The clinic pivoted to telemedicine within days of the first lockdown in order to reach patients where they were and to limit exposure to COVID. Peoples now offers telemedicine visits across all medical departments, as well as remote behavioral health and health education visits. In adult medicine, at the height of the pandemic, telemedicine helped patients who had transportation challenges and decreased our no-show rates. However, as you know, the pandemic has exposed many inequities, and just having access to enough broadband for video-based visits is one of those. Many of our telemed visits are conducted over a telephone, which has become a healthcare lifeline to those with limited or no internet service. Drive-up services complement what we do inside the clinic, where there are dedicated areas for any patients presenting with COVID symptoms. Droplet clinics are separated from other areas and follow a careful protocol for safety. To stay in touch with patients and to be helpful to the general community, Peoples began a regular live broadcast by our physicians, nurses, health educators, and even our legal director, who discussed health and other related issues affected by the pandemic. These broadcasts were in both English and Spanish on Facebook, where we have a large audience. We covered everything from children and COVID to the vaccine to legal issues facing immigrants. The clinic also extended its early childhood development program online, introducing families to children's books and creative instructional videos of art projects for kids. Shifting gears to where we are now, over a year and a half into the pandemic, thankfully, we're vaccinating our patients and the community against COVID-19. When vaccine supplies were short, People's priority was outreach to elderly and patients with chronic disease. Now, our vaccine clinics are open to all who want a vaccine, and anyone can schedule a vaccine online or on the phone. One challenge we've encountered is vaccine hesitancy. Patients come to us with many questions, and there's sometimes a lack of confidence in the science. But because our model of care here at Peoples is built on developing relationships with our patients, we are well positioned to be a trusted resource to respond to patients and help them make an informed choice about vaccination. During the early days of the pandemic, we shifted gears quickly. Because of you, our friends, we were able to make those changes. Without you, our model of high-quality care with dignity and respect would not be possible. Thank you.
Thank you, Monica. Great job, everyone. With the W. Neil Kasurik Health Advocacy Award, the clinic traditionally recognizes area leaders who have distinguished themselves through their efforts to improve the health of our community and especially those in need. This year, as it has taken an entire village to battle COVID, there isn't just one person that deserves this special recognition. There are many. We'd like to present our first Kasurik Award to the city and county workers who have led Austin and Travis County's pandemic response. This task force is unique in that no other major city in Texas put together a group quite like this to fight the pandemic. Let's hear more. In the past 18 months, we've been faced with one of the greatest public health crises our nation has ever experienced. Local leadership has never mattered more. There's a saying that when the public health system is working well, it's invisible. As we celebrate the work of the Austin-Travis County Pandemic Response Team, let's take a look at two of the critical inflection points from the past 18 months that kept disaster from happening here.
Well, throughout this whole process, there have been a lot of really hard decisions we've had to deal with. The first really hard decision, I think, was shutting down of South by Southwest. That was an extreme measure with a huge economic impact. It was the right decision, and within probably 10 days or so, it was a common decision. But at the time that we made that, It was something that was probably a little bit ahead of the curve.
I think, when you make those recommendations, they are very difficult recommendations to make. But ultimately, we have to be concerned about the health and safety of our community.
We also realized that if we did it, there was going to be a domino effect across the country. And it certainly did. That was really the point, that we saw the economic impacts happen. We saw the seriousness of the community around the country increase in terms of the concern about coronavirus.
The city of Austin and the task force that really took the leadership in responding to this pandemic and protecting our communities, they were really, I think, unique in looking at the data, looking at the science on almost a daily basis in making decisions. Almost any decision you can think of, any major decision that made it into the news, there was probably a graph, there was probably an analysis that the decision makers considered in making those decisions. And so, for example, many people are familiar with Austin's staged alert system. What they might not know is that underneath the hood, those numbers that divide red from orange from yellow, those came out of millions of simulations at the Supercomputer Center at UT, simulations that projected all kinds of possible futures and helped us figure out what are the right thresholds to protect our healthcare systems, but at the same time ensure that we keep our economy as open as possible, that ensure that we can get kids back into the classroom as soon as possible.
Our way out of COVID is vaccinations, 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 vaccinations.
We know so clearly that the vaccination is safe and extraordinarily effective. We know that most of the people in our hospitals and ICUs and ventilators are people that are not vaccinated. If we could just get everyone to do that, we would move past this crisis. But that's much easier said than done.
There is significant vaccine hesitancy for various reasons, and our health disparities. We continue to have concerns about the health disparity and how this response has really impacted our communities of color.
There's a lot that we need to make sure that we learn from having gone through this COVID experience, things we need to change in the future. It has really shined an even brighter light on the disparities that exist in our community. The people that are most susceptible to this virus are the people that are most susceptible to not having access to capital or regular health care. But in this context, we were facing immediate life and death consequences.
The most promising thing is that every day we are one step closer to getting everyone in Austin vaccinated. Vaccines are really our most effective weapon in our arsenal to combat COVID, and the more people are vaccinated, the safer we will all be.
What I'm most proud of is the incredible energy at the local level to come together and do collaborative response in ways we've never seen before. The cities and the counties collaborated. The hospital networks, there are 3 separate hospital networks who usually compete against one another, but they came together in unity to respond to this deadly pandemic.
Austin and Travis County have the lowest rates of deaths from COVID-19 of any city in the state of Texas, and one of the lowest rates anywhere in the United States. And I think it's because of that sense of community, that we had people come together. We had those stakeholders all engaged from the beginning to wage this war with us. And my hope is that we harness that sense of unity, that cooperation and collaboration, and solve other big problems that we have.
In the darkest days of COVID, it was really an honor and reassuring to be working with this task force. These were brilliant, dedicated people from so many different domains in Austin who were really there day and night trying to do the very best they could for this community. And knowing that our leadership, that the people in our community had our best interest at heart, we're working hard, we're looking at the data, we're looking at the science, we're making good decisions, was really reassuring. And again, it was just really such an honor to be part of this effort.
Hi, I'm Louis Appel, Chief Medical Officer at Peoples. It's so nice to have all of you with us here today.
And I'm Regina Rogoff, CEO of People's Community Clinic. What an incredible story of leadership and perseverance. It's amazing what can be accomplished when we all work together.
We're pleased to recognize the members of this task force. Your tireless work and leadership helped our community maintain a 50% lower mortality rate than other big cities in Texas and across the country. Many more lives would have been lost had it not been for your preparation and decisive response to COVID-19.
This award is given by the clinic annually to recognize exceptional leadership in health. On behalf of People's Community Clinic, we present you with the W. Neil Kasurik Health Advocacy Award.
I'm Senator Sarah Eckhart, and at the time I was the Travis County judge. It was my distinct honor to work on this interdisciplinary team, and I so appreciate the award. The award really goes to the whole team and also all of Travis County and every municipality in it.
Thanks so much. And as the relatively new county judge at the time and until now, I want to say thank you so much for this award. And I want to thank Senator Sarah Eckhart, Mayor Steve Adler, Dr. Escott, now Dr. Walks, and the whole team of people who pulled together to make this vaccination effort come together.
Thank you so much for the award of the Kasurik Award to the City of Austin team. Really proud to be part of it, working on a challenge that has consumed me 24/7 for the last year. Proof is in the pudding. The mortality rate in Austin, half of the state average. If the state had the same mortality rate we have in Austin, 30,000 Texans would still be alive. Special thanks to Dr. Escott and Judge Eckhart, Judge Eckhart, now Senator, now Dr. Walks and Judge Brown. It's always been about the team. We've worked closer than any other community, I think, in the state, and the proof is in the numbers. Thank you.
I'm Lauren Ansel Myers, Director of the UT COVID-19 Modeling Consortium, and I'm truly honored to accept this award on behalf of my colleagues, dozens of scientists at the University of Texas, other universities, Dell Medical School, the Texas Advanced Computing Center, who worked round the clock behind the scenes to predict COVID and to figure out how we can combat it without doing too much socioeconomic damage. And it was such an incredible privilege to serve on a city task force that is like none other than we've seen in the United States, with our leaders and our healthcare systems collaborating with each other, trusting science and data to provide guidance, and helping us all to understand COVID and to make good life-saving decisions. Thank you so much.
What an incredible testament to the foresight and quick decision-making of this team. We are lucky to live in Austin for so many reasons, but the leadership of this group tops that list of reasons, especially during this challenging time. Thank you to these outstanding Austinites. We are safer because of their leadership. And now, one of my fellow board members has a message for us.
Hi, my name is Sujatha Ajmera, and I'm the president of the People's Community Clinic Foundation Board. I want to take this quick minute to introduce you to someone super special, my best friend, my ride or die, and People's Community Clinic super fan, Maxwell Ajmera. Say hi, Max. He's super excited to be here, as you can tell. Max and I wanted to take a quick 30 seconds today to tell you why we support People's. We support holistic healthcare. We support all of the programs that we offer to the community, and all of the work that's been done this year during COVID has just proven how important the People's Community Clinic is to the city of Austin. I want to thank you in advance for donating at this wonderful event today. I hope you learn a little something about what we've been doing, and I hope to see you in person soon. Thanks.
Now we'd like to show you how clinic care at People's goes beyond a traditional doctor's office visit. Sherelle Van Brakel is the Director of Health Promotion and Community Advocacy.
Hi, my name is Sherelle Van Brakel, and I am Director of Health Promotion and Community Advocacy here at People's Community Clinic. You may know People's for its excellence in healthcare, but you may not know that our work extends beyond the clinic walls. What does that mean exactly? Well, I'd like to share with you what we've developed to help our patients live their healthiest life. In order to do this, we developed a screening tool to learn more about the specific needs of our patients. The information we gather helps to inform the programs and services here at People's. Where you live, learn, work, play, and age affects your health and quality of life. These social needs have a major impact on a person's well-being. A few examples are safe housing, transportation in neighborhoods, racism, discrimination, and violence, education, job opportunities and income, access to nutritious foods, and physical activity opportunities. Why are we focusing on things that are outside a routine medical checkup? Because, for example, people who live in substandard housing are more likely to get sick from preventable diseases. That raises their risk of other health conditions like heart disease, diabetes, and obesity, and even lowers life expectancy. But just educating a patient during a medical appointment isn't enough. We must also take action if we want to help improve health. Our action was to create a screening tool because screening is an important part of preventative medicine. Ideally, screening tools identify problems early enough for improvement at a reasonable cost. During the pandemic, the information we gathered from the screening tool was invaluable. We discovered the greatest needs during the onset of the crisis were access to internet and technology for online learning and other appointments, help with housing and utilities, and food. In an effort to mitigate these barriers, we not only helped patients at the individual level, but also at the clinical and community level. Our community health workers partnered with food delivery programs for COVID-positive patients, advocated at the city level for increased direct funds for residents, and worked with Austin Urban Technology Movement to connect our patients to technology resources and education. The Medical Legal Partnership team worked on a utility efforts, and I'm excited for Keegan to share that with you next. At Peoples, we believe that health is not just what happens at the clinic, but what happens in a patient's life, and based on that, how we can help them thrive. I'd like to introduce you to a key part of the clinic's efforts to address social needs, our Medical Legal Partnership Director, Keegan Warren Clem.
My name is Keegan Warren Clem, and I'm the Director of People's Medical Legal Partnership. Through Medical Legal Partnership, attorneys become champions for patients who are unable to advocate for themselves. Consider, for example, a family living in substandard housing, and that housing is making them sick. A medical legal partnership attorney is able to negotiate with the landlord or the housing authority to ensure that those conditions are resolved and that that family doesn't need avoidable medical care. Using legal expertise, our medical legal partnership can help stop the cycle of continually returning people to the unhealthy conditions that would otherwise bring them right back to the clinic or take them to the hospital, because we are addressing the root causes of disease and illness. As Sherelle mentioned, where a person lives is an important social determinant of health. But even with adequate housing, it is critical to have structural competency embedded in as part of the delivery of healthcare. Here at Peoples, having attorneys as part of the care team means that we can go from patients to policy. Early in the pandemic, we began to see patients who had homes but whose utilities were being shut off. Now, there were programs that the clinic could refer them to, and the legal team could certainly advise on their legal rights. But we also knew that we needed to take action that would fix this problem for all of our patients. And so in only a week, we organized a coalition of medical and legal experts to file a petition with the state. And that petition asked for an emergency rule that would suspend utility terminations for all Texans, regardless of ability to pay. We were successful because our interprofessional approach on the ground means we are ready and able to respond to crisis, whether for individuals or for whole populations.
Thank you, Sherelle and Keegan, for all you do. When COVID hit, many were impacted not only by the illness, but also the economic fallout that devastated businesses, led to layoffs, and created financial hardships for thousands. That's when a local family-owned business, So Chinese Delivery, stepped up to do their part by offering free meals to friends in the restaurant community who had lost their jobs. They soon expanded their efforts by partnering with nonprofits across the city to feed thousands of people in need. So Chinese Delivery is our second Kasurik Award winner. You know things are different at So's Chinese Delivery with just one glance at the homepage. So's no tipping policy is far from standard for a takeout and delivery business. Instead of leaving a tip, customers are encouraged to donate to provide a meal to someone in our community who is in need. In fact, the co-founders of So's, Min and Jenna Cho and Eunice and Angel Sang, established the business as a certified B Corporation in January 2020. meaning that a social service mission is literally in their DNA. When the pandemic began, the hospitality and service industry was hit especially hard. How did SOS respond? It began the So Giving campaign to provide meals to folks who were out of work and needed a hand. At first, they figured they would provide a few hundred meals, but as word caught on and the need continued to grow, the SOS team went one step further, devoting their marketing budget to raise even more funds and provide more meals.
When my wife, Jenna, and I partnered up with Angel and Eunice, we were all in agreement that supporting and giving back to our community will be a part of our company DNA, and we're happy to officially be organized as a public benefit corporation, which means that it's not only a philosophy for us, but it's in our corporate bylaws that we need to give back and have a social impact.
At the beginning, we were just serving an immediate need, and meals are when you give someone a free meal because they're in need, it's such an immediate need.
By the spring of 2021, the restaurant had provided more than 22,000 meals to those in need. In November, SO partnered with 7 nonprofit organizations, including People's Community Clinic, to provide free meals to anyone in need. This service has helped hundreds of people's patients. As you know, anti-Asian hate crimes have been on the rise. Many Asian Americans and Asian restaurants have been targeted and threatened during the pandemic, and it would have been easier and safer for the team to just stay out of the limelight. The SO team are an example of what courage, vision, generosity, and hard work can accomplish. They haven't just fed thousands of their neighbors, they've provided a powerful example of leadership and grace.
Hello, I'm Regina Rogoff, People's CEO. What a great story we've just seen. So Chinese Delivery, thank you for your commitment to fighting hunger in our community.
It's our pleasure.
So this award is named after the late Neil Kasurik, former president and CEO of St. David's Healthcare Partnership. And it's given annually to a person or a group who's been an exceptional advocate for health.
On behalf of People's Community Clinic, I'm pleased to recognize the founders of So Chinese Delivery, who in partnership with community organizations helped to battle food insecurity in the Austin area. When you founded So, you pledged to make a difference, and you certainly did, and in a really big way. So provided thousands of meals to people in need.
For this reason, we present you with the W. Neil Kasurik Health Advocacy Award. Please accept this award for all your efforts.
Well, thank you, Regina and Dr. Lewis, and to all of our friends at the People's Community Clinic. This is a special moment for us, and we're extremely thrilled for the recognition and the honor. At So, we always look to inspire our employees, our customers, and our friends to give back and also to be more involved with our communities. Well, I wanted to let you know that the PCC, you guys have been huge inspirations for me personally, and what you do and represent has made me and So want to be better for our community. So thank you for being such an important part of our city and being amazing leaders. And again, thank you for this amazing recognition. We are truly, truly honored.
Like you said, Bill, it has taken a village to respond to these uncertain times, and we are fortunate for the generous efforts of So Chinese Delivery. If you order from So's, let them know that you're part of the People's family that is grateful for their kindness. And speaking of the People's family, here's another one of our favorite family members.
Thank you, Karen and Bill. It's been a challenging 18 months for everyone, but today we've shared with you how the clinic, the community, and local leaders came together to keep Austin and Travis County one of the safest areas in the country. We're grateful for all of you and your support and for all we've been able to do together and all the work we'll continue to do. Even though we're facing unprecedented challenges, Peoples will continue to set the bar high for compassionate and competent care, even during the toughest of times. We ask you to join us by investing in People's Community Clinic as we strive to fight COVID and protect the health and well-being of our community. People's Community Clinic is as much a part of this city as live music and Longhorns. Please give to support People's Community Clinic and keep Austin healthy. Thank you.
When the COVID vaccine became available during the early part of 2021, supply was limited, and getting a vaccine was difficult. Many folks just were not able to negotiate the websites and the online sign-up lists. Then a remarkable thing happened. Here is the story of our area's vaccine angels, who are our third Kasurik Award winner. When the first COVID vaccines became available to the general public, the rush for appointments was overwhelming. There were different, complex online registration and booking procedures for every county and health district. Securing a vaccine required access to a computer and the time to devote to search for available appointments. That system of distribution was not accessible to thousands of our neighbors, including those without Wi-Fi or home computers, those who are visually impaired, the elderly, or anyone without skills to navigate the sign-up process effectively. In response, a group of individuals began to help others navigate the system and successfully secure appointments. These vaccine angels worked for hours every day to ensure that people in need had access to vaccines, even providing transportation for those who couldn't drive to their appointments. These grassroots teams were on the front lines of the battle for health equity and securing vaccine access for thousands of our neighbors across the community.
Hi, everybody. I'm Dr. Lewis Appel, Chief Medical Officer for People's Community Clinic. It's so inspiring what you all did, and speaking from the perspective of folks who were trying to get our own patients immunized and access. It was so clear from the beginning that there was such a disconnect between the technology that people were being forced to use and what people had access to, that what was needed was a human connection. And that's what you all provided, was that piece of humanity. And I think it's that relational piece, that actual person-to-person connection that really makes a difference. And it's what made a difference in this. It's what makes a difference in healthcare. And it's really what health is about. And I'm just so inspired by what you all have done and what you're continuing to do. With that, I'd like to just say that all of you who came to be known as vaccine angels dedicated countless hours to help others get vaccinated. Your efforts saved lives by helping to prevent the spread of COVID-19. On behalf of People's Community Clinic, I'd like to present to you the Vaccine Angels of Austin, the W. Neil Kasurik Award for Healthcare Advocacy. Thank you for your remarkable service to our community.
I think for many of us, this became a bit of an addiction. And it's kind of like, okay, we've helped, all the elderly people we can find. Let's find people who, English is not their first language. Let's find people who are working all day with children or working all day in retail. Who else can we find? It was kind of like unearthing people, because a lot of folks felt they didn't deserve our help after, and there was a period where there was more vaccine available and there was people who weren't getting vaccinated because they didn't have time or didn't want to deal with it. And we almost had to tell people, it's okay. We are happy to help you. Please fill out our form. So it was fun.
That, I think, was one of the most beautiful things that all of us witnessed, the community coming together to get the seniors vaccinated. Those were very scary times earlier this year. And I think that made us, we didn't mind staying up all night long to get them appointments. It made it magical.
And now, our featured presentation. I am happy to hand it over to Evan Smith of the Texas Tribune, who will introduce and visit with our featured guest, Dr. Peter Hotez.
I'm Evan Smith of the Texas Tribune. It is always an honor to be here on behalf of People's Community Clinic and to be here with all of you. And I'm especially pleased to be with Dr. Peter Hotez, the leading virologist in Texas, founding dean of the National School of Tropical Medicine at Baylor College of Medicine in Houston, and co-director of the Texas Children's Center for Vaccine Development. Throughout the pandemic, you've not been able to turn on the news read an op-ed page, or doom scroll through social media without seeing Dr. Hotez's name, or conjuring the image of him we've come to know. Tucked into his office, always in a bow tie, often in a lab coat, a mix of calmly reassuring and bracingly candid. He's our state's version of Dr. Anthony Fauci, ubiquitous, expert, and apolitical to the extent that anything about the coronavirus is apolitical. And with the understanding that being apolitical is not the same as not having a point of view. Dr. Hotez definitely has one. He's been a crusader for years, for instance, against the flat earthers who reject science and recoil at vaccines, a fight he always believed was his responsibility to wage, but never more than now. His most recent book, published in March, is titled Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Science. Dr. Hotez, it's good to be with you this morning. Thank you.
Evan, it's always good to see you, even if it's virtually. I'm looking forward to seeing you in person again, not too distant future, post-apocalypse.
One day, Dr. Hotez, one day we'll be together, I assure you. So I'm thinking as we talk today of two headlines that crossed my phone. One was in the New York Times, David Lionhart's column, COVID-19 is in retreat. The other is an Austin American-Statesman note that said that Austin has technically passed the threshold, allowing the city to go back to stage 3 of 5 stages, an improvement in the public health emergency, but that city health officials are reluctant to actually pull the trigger on that. I wonder if you would reflect on those two notions. One is that the disease is in retreat, but the other is that we're a little bit hesitant about getting irrationally exuberant again and racing to normalize all of our lives. What do you think about that?
Well, Evan, we've seen now Mother Nature has told us what COVID-19 does. Yes, COVID-19 does go into retreat, but then it regroups and launches a new counteroffensive. And I think we have to, Mother Nature's not been coy about what she has in store for us with COVID-19. Look what happened last summer when we had that horrible wave across Texas, and we were talking all the time, and that devastation, especially among Hispanic communities, and parents in their 40s and 50s and 60s losing their lives, and then it came back again this summer. It not only in Texas but across the southern United States around the same time, and now it's going down around the same time. But all we have to do is look what happened last fall, when after Halloween, starting in November, it really revved up, and that was our worst wave yet. So that devastating one that also affected Texas in the winter. So that's what I'm worried about, that we're once again becoming complacent. We think this is over. We're already hearing this on some of the Sunday morning talk shows that this is it. We're finally going to be out of it. We just have to get a few more people vaccinated. And I don't think that's the case. I think there's too many unvaccinated people. We've only vaccinated about 56% of the country that's been fully immunized. And now the goalposts are going to move again on what it means to be fully immunized, because we're going to need 3 doses of each of the mRNA vaccines. We'll soon hear 2 doses of the J&J vaccine. So there's a lot of warm water for that hurricane to pass over across the country. And we're already seeing this pop up now across the northern border with Canada. Wisconsin, Minnesota, North Dakota is looking really bad right now.
Starting to get bad. Dr. Hotez, you mentioned 56% fully vaccinated, at least as of the standard that we measure that by now around the country. Texas is behind that, right? Texas is basically at about 51% fully vaccinated. I mean, I'm old enough to remember when Governor Abbott went on Fox News a few months ago. It's actually more than a few months ago, and said we're approaching herd immunity. The reality is, Dr. Hotez, we're not there. We're not near herd immunity, and we're probably never going to get to herd immunity at this rate, right?
Well, I don't even like using the term herd immunity anymore, because it's been so highly politicized, especially from the far right, using it as an excuse to prematurely relax our guard against COVID-19. And we have to remember how to look at this. Texas is a big state, and it's not homogeneous. And when you actually look at vaccination rates, what you're seeing is we're substantially higher than 51% in our urban areas and along the border with Mexico. We're doing a little better vaccinating. But Evan, you go to some of these rural counties in Central Texas and East Texas, forget it, nobody's vaccinated or very low. So there's nothing to impede the Delta virus from continuing to cause a lot of devastation. And, when you look at what's happened here in Texas, I can't say enough of how awful this has been. I see this as the worst single tragedy that's ever happened to the state of Texas. And I back that up by saying we're already at 66,000 deaths in the state of Texas. And
about 1 out of every 455 Texans has died during the last 19 months.
It gets worse because if you look at some of the Institute for Health Metrics evaluation projections, we're going to get towards 80,000 deaths by the end of the year. And I think, unfortunately, we are going to hit this. And the other piece of this, of course, is the most recent 10,000 deaths were completely unnecessary. Those 10,000 deaths occurred despite the widespread availability of safe and effective vaccines.
Right.
That is it's probably one of the most demoralizing things I've ever had to deal with in my 40 years as a MD, PhD physician scientist, is seeing those 10,000 people's lives needlessly snuffed out when they could have easily been saved.
Well, you mentioned that there's a disparity depending upon where you live. Geography is destiny as far as how this disease has progressed over the course of the last 19 months in Texas. You can't say that access was the issue in many of these places where the vaccine rates are low, right? It was a conscious decision on the part of the people who did not get vaccinated. And, they took the responsibility themselves for making that decision, but also we can't let leadership off the hook in those communities and at the state level. It does matter what the people in charge say, right?
Well, I even look at it a little bit differently than from that. I see those 10,000 lives that have been unvaccinated lives lost most recently as victims. They were victims of targeted, I don't even call it misinformation anymore, Evan. I don't call it disinformation. I call it what it is. This is anti-science aggression. Yep. These are groups that have deliberately targeted people across the state of Texas and nationally by more or less saying, to belong to our club, to belong to our tribe, to show allegiance to our right-wing extremism, it means not being vaccinated. That's not the only thing. There's a whole canon of ridiculousness from ivermectin and everything else, but among them is not being vaccinated, all under this fake banner, this phony banner of health freedom, medical freedom, which is the most self-defeating concept that I could possibly imagine. And it's a killer. Anti-science right now is one of the leading killers in the state of Texas and nationally.
But of course, people who choose, Dr. Hotez, not to get vaccinated will say this is a personal decision. It only impacts me. You don't agree with that?
No, absolutely not. Well, first of all, not only does it impact you, it impacts your loved ones, your family members, the people you work with, but it also has created this horrific surge on our hospital system so that individuals who have other medical conditions are not getting the care that they need. It's a huge economic expense as well. So the idea that health freedom only affects you is ridiculous. Right. And what it does is it interferes with the freedom of others, because now you have parents who live in terror because of these individuals that their kids are going to get sick in schools, or they're going to get sick, especially if they're pregnant. So the vaccines are not perfect. They're good, but they're not perfect. And we do see this. So this is, and some people can't get vaccinated, like the little kids. So this is devastating.
Are you surprised, Dr. Hotez, at the existence of these breakthrough cases that we've seen over the last several months where people were fully vaccinated and yet still contracted the virus? I mean, to me, as I think back over the last year, the thing that's most surprising is we were presented with the vaccine as an answer. And there is no perfect answer to anything, but we were told, get vaccinated, this is actually going to be the way forward for us. And in fact, it turns out that many people who were fully vaccinated and went into their futures with confidence, it didn't ultimately work out the way they thought, or any of us thought.
Well, I think there was a problem with messaging these vaccines early on. When I saw that the first 2 doses, for instance, of the Pfizer vaccine were given 3 weeks apart, I understand why we had to do that. We had to do that to fully immunize the healthcare providers and the nursing home residents and workers to keep them safe. But when you created that 3-week interval, that's not what you would do to create long-lasting, durable protection. So I've said since the beginning that the Pfizer-BioNTech vaccine is going to be a 3-dose vaccine and the J&J vaccine is going to be a 2-dose vaccine. From my standpoint, this was predicted and predictable that we would need a third immunization, just like we do all of our pediatric vaccines. We give a series of immunizations to our infants and young kids, and then we wait 6 months to a year, and then we boost, and that's how vaccines work.
So you are for the idea of a third shot. You're for the idea that any of us who's been fully vaccinated, we got to get a booster, whatever the timetable is. That's going to be necessary for all of us going forward.
I think so. And in fact, I don't even call it a booster. I always say this is a 3-dose vaccine. This is your third immunization. Right. Absolutely. Right. And what that will do is it's going to really jack up your virus neutralizing antibodies to protect you against infection. It's also going to give you longer lasting protection. So I don't necessarily think we're going to need a booster every year. And I think it'll give you more resilience against all of the different variants as well. So it's going to do a lot of things for you.
As you say, a lot of different variants, I begin to shudder because I worry that we'll get through the Delta and then there'll be something behind the Delta and then something behind that. It makes me wonder whether this thing will ever actually come to an end, or it's going to be more like the half-life of plutonium, gradually moving toward the horizon line but never getting there. It's
not a bad metaphor, but it could be like that. But on the other hand, when you look at places that have aggressively immunized to you, where you get over 90% of the population vaccinated, like they've done in Portugal, like we're approaching in some of the New England states. I think we can stop it. But the problem is the bar is high. And it's, when you've got a virus like the Delta variant that's got a reproductive number of between 6 and 8, what that means is you have to get to 85, 90% of the population vaccinated to buffer you against incursions of the virus and new transmission. And that's probably going to mean, and fully immunized, that goalpost is moved to 3 immunizations. So you could say 85, 90% of the whole population, not just the adult population, the whole population, vaccinated with 3 shots. You're going to say, well, we can never do that. Well, and the answer is, of course we can. We've done it for decades in Texas, for measles, for polio, and
isn't that the point, Dr. Hotez? There is a frame of reference here for vaccinating people against disease. We're acting as if somehow a vaccine mandate or a requirement that people get vaccinated for COVID is some new thing. When rubella, mumps, polio, meningitis, a lot of the very same people who have been complaining about mandating vaccines themselves submitted to a vaccine mandate when they sent their kids to public school, or when they themselves went to college. So somehow we're in a different place right now, but we have a history of making it so that people need to go along.
Well, yes, but also, Evan, unfortunately, Texas has been the tip of the spear of trying to erode childhood vaccinations as well. We have a very aggressive anti-vaccine lobby here that started pre-pandemic. It really revved up around 2015. We have our own political action committee, our own anti-vaccine PAC that's trying to interfere with childhood vaccination programs and basically say that, it's your choice whether or not you want to vaccinate your kids for school. And that's also created a lot of vulnerabilities. We have over 70,000 kids, according to the Immunization Partnership, that could be missing some of their vaccinations.
So this
and
is
that doesn't count for any of the
300,000
homeschooled kids. So
it's fertile ground in a moment like this for a conversation around vaccine mandates, right?
Yeah, absolutely. And if we're serious about keeping our kids safe, and we're going to need a COVID-19 vaccine mandate as well. And if you are committed to in-person classrooms and in-person classes, which I think most of us are. I certainly am. I'm the parent of 4 adult kids. When my kids were little, I wanted them, of course, to be in school. It's doable, but you've got to put the policies in place to make that happen. And that means mask mandates and vaccine mandates. And if we keep on resorting to phony medical freedom, health freedom arguments, we're just not going to be able to keep our kids safe.
Do you think ahead, Dr. Hotez, to the possibility of another pandemic and what we may have learned from this, and whether we are, as a state or as a country, prepared for the next time based on what we've been through now?
I would say we've not we've learned a lot of lessons of what's not working, but we haven't fixed very much. So, and that's both at the federal level, state level, and local level. I mean, at the federal level, our Centers for Disease Control and Prevention came up small so many times. We still haven't fixed that. And now the White House Science Advisor, Eric Landers, proposed we create he calls it a pandemic mission control in Washington, D.C., in which I say, well, that sounds good, but here's why it's not a good idea. Well, first of all, we saw in 2020 why you don't want to lead pandemic responses out of Washington, D.C. That's number one. Number two, and what they're really saying is we don't trust the CDC. We're going to create a mini-me CDC based in Washington. I'm saying, no, the answer is we got to fix the CDC.
Fix the CDC.
We're paying $15 billion in taxpayer money. And if it's not doing what we need it to do, let's do that and maybe refocus it only around pandemic threats, maybe some of the other things we don't need the CDC for. Let's figure out why they missed the virus entry from Southern Europe into New York, why they didn't protect the southern half of the United States in 2020 from the pandemic, why they never got diagnostic testing underway, why they never got genomic sequencing underway, why we still rely on Israel and the UK for all of our vaccine effectiveness data, why there's no predictive models, just coming up small at so many turns. This needs a fix. And if we can do that, then we can lead pandemic response operations out of Atlanta, which was why it was set up. And I think that's where we have to put the focus.
So in the last couple of minutes we have, Dr. Hotez, I want to ask you about the public health ecosystem. Did public health step up adequately to address the worst aspects of this?
Yeah, and I saw this with Zika as well. And the same problems that we had with Zika were the same problems we have with COVID-19.
Yeah.
And that is we had, it was very much, a lot of it was done at the local level, and the quality varied quite a bit. So here in Harris County, where we actually have 2 public health departments, we have the City of Houston Health Department and we have Harris County. That's a pretty well-worked, those are well-oiled organizations and adequate, nothing is ever adequately supported, but it's better supported than some. But then you go to other counties across the state and they have almost no infrastructure in place at all. And you saw this massive, and of course in Houston, we have our Texas Medical Center, which has a lot of heft in terms of beds and staff. But you saw, especially in South Texas, how quickly those community hospitals got overwhelmed, or up in the Panhandle, how quickly those community hospitals got overwhelmed. A lot of the public health departments didn't have the tools or the staff or the backing in order to do what they needed to do. And that's why we hit 66,000 deaths. Evan, I think, if this trend continues, we're about to eclipse California as the worst state in terms of deaths from COVID-19. And that's just a horrible legacy. So I think, to honor those lost and that catastrophic loss of life, we really need to have to take a hard look at what's not working and try to do as best we can to fix it.
Okay. Dr. Hotez, it's been good to be with you. I mean, I can't say that I am walking away more optimistic about the world or uplifted, but what we look to you for is honesty. And in a moment where people are living in a state of denial rather than in a state of Texas, I appreciate you giving us a level set. So thanks so much.
Thanks so much, Evan.
All right.
What a great conversation. Thank you, Evan and Dr. Hotez, for the insight you provided us today and for sharing your time with us.
And time has flown, but we're nearing the end of our program. It's also the beginning the beginning of another year of the great work from People's Community Clinic that is possible because of you. 12 months from now, we'll look back on another year and hopefully we'll be able to do that in person. I can't wait. But before you go, the incoming Vice Chair of People's Foundation Board of Trustees has a few final words.
Oh, I didn't see you there. Hi, welcome to my living room. My name is Lindsay Leverton. I currently serve on the board of directors for People's Community Clinic. I am here to tell you, no, actually, let's be honest. I'm here to beg you for money. I don't want to hide it. I don't want to mislead you. I am here to tug on your heartstrings and your purse strings. Let me tell you why this matters to me, or let me sing for you why this matters to me. Back in the day, sometime last year, I can't remember when because time's no longer clear. What is time? Is it 2021? Anyway, I got the shot, but my wife could not. We searched everywhere, but couldn't find an open spot. And then as she was just about to give up and go into the world unprotected, I reflected. What about Peoples? So I picked up the phone and called PCC. Wifey got vaxxed within 1 week. So if you have some time, $1 or a dime, or preferably $1 million, make your checks out to People's Community Clinic. Give, give, give to People's. Give, give, give to People's Community Clinic. Yeah, no, it's not going to be a big finish because it's just a ukulele.
Thank you for joining us, everyone. We know that you're very busy and that you receive a lot of invitations to events like this one. We appreciate you taking the time to be with us and for supporting People's. Without you, People's work wouldn't be possible. And because of you, lives are changed.
Goodbye, everyone. Thank you.